This family health and wellness segment is brought to you by GlaxoSmithKline Consumer Healthcare.
For fast, triple action relief of pain, fever and inflammation, use Grandpa. Trust Grandpa, South Africa's #1 pain reliever. Available in powders and tablets.
Expresso's back at the Wits Gordon Medical Center with our resident GP, Dr. Lerato to chat about one of the body's essential defense responses, namely inflammation. It's the body's first attempt at self-protection, but when is enough, enough?
Inflammation summons the body's microscopic soldiers to get rid of foreign invaders like bacteria, fungi and viruses. But there's a difference between short-lived acute inflammation and chronic inflammation. Wonder which is which? Let's step into the doctor's office.
An unconventional office.
Doctor, so what is inflammation and how does it occur?
Inflammation is a physical condition, meaning it's something you can touch and feel and see. And it occurs as a reaction to an injury. Now, injury can be anything from trauma, such as when you sprain your ankle, to an allergic reaction perhaps on the skin with an itchy rash, and also maybe sneezing with a runny nose, but also commonly, as you mentioned, infections, bacteria, fungi, viruses. All of these things can cause an inflammatory process. So now you can see inflammation is not an infection and should not be used synonymously. When inflammation occurs, there are what we call inflammatory mediators. Now, these are chemicals and hormones in the body. They will now start sending back messages back and forth between the brain and the site of injury, trying to protect the body, to remove the harmful stimulus and initiate a healing process.
Where in the body can inflammation occur?
Inflammation can happen anywhere in the body, from the very vulnerable skin, which is on the outside of the body and susceptible to a lot of external mediums, to your internal organs, which are very well protected, but they can also get inflamed, including the brain behind his hard skull. It's not exempt from inflammation. So basically, from head to toe.
How do you identify inflammation?
There are 5 basic things one can look out for, what we doctors call as 5 cardinal signs of inflammation. The word inflammation literally means to ignite or set alight. So it will be redness and heat. There'll also be pain, swelling, and loss of function. Imagine the body sends out all these soldiers to go fight something. So there's an increased number of cells in and around the area, hence the swelling. And for example, if your knee is swollen, you're not going to be able to move it nicely. So there'll be loss of function. Same with your lungs. If they are congested and inflamed, you won't be able to breathe, so you lose functioning of your lungs. And likewise in the nose. If it's sneezing and congested, you end up breathing with your mouth.
How do you treat inflammation?
The best way to treat inflammation is to actually try to avoid harmful stimuli. So if you know you're prone to allergies or injury, try not to get into those situations. I'm not talking about avoiding your mother-in-law, your boss here. However, it's not always possible to avoid other allergens such as air pollutants. I mean, if you ask me, I would rather breathe, have a blocked nose, than stop breathing, okay? So in that case, you will just have to control with things like antihistamines because they stop the inflammatory mediators from going crazy. If you have an injury and there's a swelling, you could elevate, if it's the arm or the leg, and put cold compress on it. That should help relieve some of the symptoms, especially pain and swelling. If that fails, you can take over-the-counter medications that will help with stopping the inflammatory mediators from carrying on.
When should a doctor be consulted?
Well, inflammatory reactions can actually be categorized into 3, say mild, moderate, and severe. In the severe cases, such as a very bad asthma attack or a bad allergic reaction to an insect bite, you need to take these people to the emergency rooms. In the moderate ones, where you say sprained your ankle and it's not healing with medication at home, you can go see your doctor and get some prescription medications for it. Luckily, most of them are mild and can be safely treated by ourselves at home with antihistamines or inflammatories over the counter.
Well, thank you very much, Dr. Lerato. I'm certain our viewers have gained a lot from your wisdom and knowledge. I know I have. If you have any queries or concerns about today's topic, we suggest that you consult your medical practitioner.
For fast, triple action relief of pain, fever and inflammation, use Grandpa. Trust Grandpa, South Africa's #1 pain reliever. Available in powders and tablets.